from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
One of the most important issues facing America today, and certainly will be a comprehensive discussion throughout the 1990s, is the issue of health care and coverage. And many Americans do not have any coverage at all. In fact, the latest statistics indicate that over 37 million Americans are without health care coverage or insurance coverage. And we're very fortunate to have on our program today a person who can discuss this, and particularly we want to emphasize what's going on in the state of Idaho. And I should add that we're going to have a series of programs on health care, and this is the first of those programs this year, along with other topics that we'll be discussing through the months that lie ahead. I would like to welcome to the program Mr. Roger Sherman, who is the Executive Director of the Idaho Citizens Network. Mr. Sherman is well known for his work on a number of issues, health care being one of the most important, and a lot of other questions that involve the consumers of our state and his activity. And he has come up today from Boise to be with us. And Roger, welcome to the program.
Thanks, Tony.
And as always, I'm pleased to have Janelle Burke, who is a member of the panel and has been. In fact, this year she is starting her 18th year on the program, and of our 21 years, and we're delighted to have you back, Janelle, for another year.
Thank you, Tony.
At this time, I'll ask Janelle to commence the questioning.
Well, Roger, let's just jump right into this important issue and talk about what are the problems that Idaho faces with their health care.
Well, a lot of the problems that Idaho faces are the same ones that are faced by everybody in the country. And then there are some that are unique to Idaho's situation. We have nearly 200,000 people in Idaho, 1 in every 5 people without health care coverage. Almost 1 of every 3 children in Idaho is without health care coverage. A unique situation for Idaho is our ruralness. We have fewer doctors to serve the people in Idaho than any state in the country. We're 50th. The number of other kinds of practitioners, nurse practitioners or nurses in general, are very much lower than our surrounding states and then exist in other parts of the country. And that, of course, provides or creates a problem for the people living in rural areas and forces people to seek services in centers like Coeur d'Alene or in Boise or in Twin Falls or Pocatello.
And that makes the cost go up, I would assume, for those people.
Well, it does for those individuals. It makes the cost go up. Idaho has a sort of a strange situation in that we are, because we have fewer services, our costs actually are lower as compared to other parts of the country. That doesn't mean we're getting good access. It does mean that the services simply are not available as they should be. Yet at the same time, we're spending nearly $2 billion. We will spend nearly $2 billion this year for health care services in the state.
What other problems are out there also, in addition to a lot of uncovered people and lack of health care professionals? What other kinds of problems exist?
Well, of course, this is it's an individual problem. I'm sure a lot of the people watching the program will understand firsthand what it means, and that's really what it comes down to: is what does it mean for a mother who can't get prenatal care? What does it mean for that child who doesn't receive the care, in the womb, and then is not able to receive the care after they're born, if they have needs? What does it mean that we make choices that our long-term care system is oriented towards older people being in nursing homes and other kinds of institutions rather than being supported at home, as is done to a limited extent in this state and throughout the country, and that is done more so in Europe and other places. So there are a whole lot of questions, that really affect the quality of life for people, that really affect how we as a society address a really fundamental question. We have a system that's really set up around paying for cure of illness, not necessarily built around how do we maintain a healthy life for all of us, for our children, for our future, for our elders.
I'd like to pursue it a little bit further, Roger. There's just so many different ways to go and there's such a little time in which to do it. The governor of Idaho has a task force that's been studying some areas of health care, and one of them is the elderly and dealing with home care versus being institutionalized. And I was talking with a member of that task force, Bethany Church, recently, and she indicated that their findings were that a lot of people are in a nursing home and care that could be taken care of at home, or there are others that are at home that may have to leave if we don't just do certain things, not meaning to suggest that we don't need nursing homes, and there are people who
Right.
have to have intensive care. Is that one of the issues that the Idaho Citizens Network is addressing in the whole question of health care?
You bet. One of the things, I mean, one of the major issues that we're looking at is the issue of cost. And, you know, fundamentally the issue is about, you know, what do we want, you know, what do we as people want? You know, what would we like for ourselves, and what do we want for our families and for our friends? It's overwhelmingly the case that people would prefer to stay at home, in their own home, if they could do that, rather than being in a facility. Of the public dollars we spend in Idaho, the largest chunk of that goes to keeping people in nursing homes, because most people who go into a nursing home situation end up on public assistance. It's something like 60+% of the dollars going into nursing homes come from public dollars, from Medicare or Medicaid, primarily Medicaid.
Also in this study, they had found that with just some changes in the whole structure and the funding and all, that there are a number of elderly people that could remain home if they could have someone to come in even once a week or twice a week to assist them with the care of the home, or with bathing, or whatever it might be, or sometimes once a day for medication. Are you optimistic that this particular issue will be addressed in the near future in the state of Idaho?
Well, we and a number of groups throughout the state worked to expand those kinds of services a couple of years ago, and the need for those services is growing. I think that there's a lot of things that we have to, you know, that we have to work through, and people need to. The interests that maybe benefit from keeping those kinds of institutional placements alive need to start working with others to figure out, you know, how they can be players in that game, how all of us can create the compromises necessary so that we can create a healthcare system which really works for seniors and people with disabilities and all of our families.
I'd like to go to the other end of the spectrum, if I can, in age, and go to even prenatal care, and also with young children. And I really have a two-part question for you, Roger. What kind of job are we doing to help expecting mothers who are very low income and so forth with the kind of care they need that may affect the child's throughout its life as it comes into this world? And secondly, would you address the question of young children, and are there things that we could be doing that we're not doing that will affect the whole issue of health for they and their families?
We have, over the last couple of years, made some very significant improvements in the services available. The federal government has placed real emphasis in that area. Like I say, 1 out of 3 of our children in Idaho doesn't have health insurance, so they wouldn't get it through that mechanism. So the Medicaid program that provides care to low-income families.
If I can interrupt on the Medicaid, it only covers certain families. There's individuals in there between those who have health insurance, private health insurance, or have income to where they can afford it, and those on Medicaid, isn't there? Right,
except that there is a program which has come in over the last couple of years and is being phased in, which provides services to families who now are even slightly above the poverty line. And in the past, of course, it's been way below the poverty line. So they can receive Medicaid services for the mothers can receive prenatal care, and the children, now up to the age of 6, are provided with health care services, particularly periodic screening and testing, some of the services that will mean that, you know, we give kids a healthy start and get them out, and, you know, so similar to the Head Start program in school, that we look at how do we provide you know, services so that kids are ready to go to school, ready to do whatever they want as they get older. And
not being very familiar with that program, is incorporating into that program any counseling or advice on nutrition and so forth, even for those children who are already very healthy, but to prevent certain possible health problems?
Unfortunately, Tony, I'm not real familiar with that piece of it. I know that there are some programs like the Women, Infant, and Children program, which is strictly geared, what they call WIC. That program is strictly geared towards the issue of providing nutritional supplements and making sure that people learn how to eat right and deal with the things that we as consumers of healthcare, as people, can do for ourselves without the need of medical care.
If I can just broaden that question, then I'll go back to Janelle. Even if we go from the question I just asked to the entire population, and with your background in healthcare, have we not spent an awful lot of our attention, and we have to, I know, spend an awful lot of money there, on dealing with healthcare when people are ill, but we've not given much emphasis to the preventive processes to create a more healthy society?
Oh, that's tremendously true. There was a letter in the October issue of the Consumer Reports from a doctor, and his suggestion was that insurance covers illness, not health, and pays accordingly, which I thought was a great short statement of what really is happening with our healthcare system. That a lot of people choose not to go to the doctor until they find themselves in a situation where they're sick enough that their insurance is going to pay, or that they absolutely have to go. And so as a result, people are sicker, and it costs the entire system more. It costs all of us more.
Janelle Burke.
Well, what I hear you saying then is prevention is important, and it makes economic sense. So I want to talk a little bit about that whole area. Okay. First of all, people may choose to stay at home, say in the case of older people, or in the case of new mothers, they may choose to get care. But if they don't, and they wait until they're ill, then it does make economic sense to try to do something to prevent that waiting until the last minute. So let's talk a little bit about what kind of economic sense that really makes. Is it a savings, and what kind of savings is it? Is it a significant savings?
The traditional figure is that for every dollar spent in prevention, particularly in prenatal, saves $7, to the system overall.
Having a healthy baby, in other words.
Having a healthy baby. Because most, when you look at the health statistics, children overall don't get sick. I mean, they've had colds and runny noses and what have you. But when you look at, most children end up doing pretty well if they get good prenatal care, if they then are given the care that they need when they start out, and they get the immunizations they need. It's an incredible thing. We've had 2 major epidemics in this state in the last couple of years. One in measles that hit primarily junior and senior high school kids because the immunization level was so low, and we're having a building epidemic on whooping cough, which are diseases which I think most of us have thought of as ones that we don't have to deal with anymore. But unfortunately, the state and the whole educational process hasn't pushed that the way that it ought to, because immunization, of course, is the most effective preventive medicine.
And in the case of older people, being able to stay at home is a significant cost cutting over having to go into some kind of an institutionalized situation.
On an individual basis, that's true, Janelle. The problem is that we have set up systems that continue to reimburse nursing homes and other institutional facilities at levels that where we almost end up paying for both of those things at once. So when we really look at the savings to the entire healthcare system, we need to do that over time, looking down the road to when, say, I'm an older person, or my children are older people.
Now, for many of us who are covered with some kind of insurance system, we probably have 2 concerns. One is the rising cost of health care, and secondly, that the system that insures us remains solvent. And so what is happening? What are you doing along those lines for those of us who are sort of in the middle there?
I mean, just to talk some about the problems, I mean, we know that right at this moment there are 14 states where the Blue Cross Blue Shield systems are either on the verge of bankruptcy or have in fact been shown to be insolvent. The public systems like our county indigent program, our Medicaid program, are really in serious trouble because of the cost of because of the rising cost of healthcare. Medical inflation is driving it to the wall, and medical inflation is rising twice to 3 times the rate of general inflation. So the cost of everything else we buy doesn't compare to the costs that we're paying in healthcare. There are a number of things being done. I'll talk about what the Citizens Network is
Okay.
interested in doing. We really believe that we need a comprehensive overhaul in the healthcare system, that we need to create a system in which we pool all of the dollars available within the health system. This year that would be $2 billion. The money that's collected from premiums, the money that's collected from our public programs, put it into one pool that is run then by a board of governors that establishes benefits, and that has the power then to determine where dollars go within the healthcare system so that we use money most effectively. We have, with our current insurance system, set up a system which is so complicated. Most people don't understand, how it works, and there's so many hoops to get over. Each of those systems that we've set up, the way that we fragmented the whole healthcare payment side, costs us a whole lot of money. The cost of administration throughout the entire system costs us well over 20%, according to the studies done by the General Accounting Office. And what that tells us is that 20%, even if we only dealt with the administrative piece, would be able to save us enough to be able to see that everybody in the system could be covered.
I just want to interject here because I just have some data with me that it was 24 cents out of every dollar, speaking nationally, goes to this administrative cost that you're talking about. If I have a great interest in what you're doing in the Idaho Citizens Network, and I would just follow up, Janelle, with that. Sure. I know last year in the legislature you proposed the Idaho Health Program, and you've indicated what your overall package is. Mm-hmm. For those who are out of our state and aren't familiar with what's going on in Idaho, this would require legislation by the Idaho legislature, and then would this legislation mandate that this would all be pooled? And give us a little more details how this whole process would work, about whether you work for a corporation or you work at a university or wherever you work in the state. Would everyone come under the same pool?
Everybody would come under the same pool, Tony. It would be, and people say, well, why don't you just solve the problem for the 200,000 Idahoans? That is the most expensive way that we could do that. And it would be, and what we would do is drive the system to collapse by attempting to create one other pool, which is just going to cost more and more and more dollars. Under the Idaho Health program, everyone would pay a payroll tax, similar to the way that we fund Social Security. We would fund a health care program. And what the economic studies have shown is that by doing that, we can actually provide more health care for the same amount of dollars than we're currently providing.
But at less administrative costs.
And much less administrative costs.
Let me interject here. I just want to get so much of this in because it's an exciting proposal. Then all of those people who would not be paying in, that is, that they are in a category of retired, or of course some of them would be under Medicare. Would this pool then include all those people you've been talking about that have no coverage at all? They would come in under it also? Well,
the majority of people who are not covered are people who are working, or their children. So,
and I realize that, but
so the people who are covered under the programs like Medicaid or the programs like Medicare that are public programs, those dollars would be pooled into this, so that we would use those most effectively. We have a system now which is not at all equal for the players within it. We all have these different cards, right? Each of these cards is a good symbol for what the healthcare system is like. If you have the Medicaid card, there are many providers who do not want to take that. Increasingly, the Medicare card is the same. The Blue Cross and Blue Shield card is better, and I might have a funky insurance that nobody's heard of, and I have to pay up front and get reimbursed. So each of those kinds of cards becomes either your key to the executive washroom, or it's or it is a key to nothing.
But it would become inclusive under this program.
All of those dollars would be pooled.
Then I have another example of that's in the legislative process or in our policy for employees in the state. Firemen in particular, women and men who are in the fire departments, they can retire on what we call the 80 plan, their age and number of years they've worked because of the stress. Police officers in this situation. A lot of educators retire at about 58 or 59 under the 90 plan. Again, the number of years they've taught and their age. And they have a period of time from then until they get to be 65 to be covered by Medicare, and they're in the kind of the twilight zone, and they have no coverage. Would they become part of this pool, or would they pay in? How would those kind of individuals be affected by this?
Well, people who don't receive income, from a work situation and who actually retire and would still be covered because they currently are in the system now. Mm-hmm. Because actually those individuals are part of what is, part of this $2 billion that's being spent in the state for health care is going towards their health care as well.
But there's a period of time, well, like at universities in the state, a lot of times when they retire, they will be carried on that insurance for another year or so, like from age 58 to 59, but then they're not paying in premiums and they're out on either with no insurance or they're getting their own private coverage. How would this affect those individuals? Would they continue to pay a premium like they had at the institution where they'd worked? I'm just not sure how they would be covered by that program.
There are probably some of these questions, Tony, which it is very comprehensive when you look at each of these different kinds of situations. The complexity you're talking about is really sort of the problem with the overall, is that there are a whole series of different ways that people finance their healthcare services.
I'm rushing, but there'd be a way in that.
There would be a way, right? Every person in Idaho will be covered under this, okay. And it may, and there will certainly be fine tuning that will have to be done as the program's put into place and is developed.
Sure, Janelle Berg.
What are the advantages to the healthcare providers with a system like this?
Well, particularly for the rural healthcare providers, it will be a far more predictable situation for them. As you know, I mean, we're seeing hospitals closing, we're seeing doctors leaving towns and increasingly concentrating in the more urban areas of Idaho. And that's because in those rural areas, one, we reimburse at a lower rate, which doesn't make any sense. We don't provide any sort of support for those physicians or nurse practitioners, physician assistants who work there. And so as a result, we can't keep providers working in the places where we need them. Under a program in which you have what's called a single payer of healthcare, you're able to target your dollars where you need them. So that instead of what we have in Boise, where two hospitals are spending $36 million on expansions that provide very little new healthcare services, we could look at the money generated within the system to actually provide support to the people who need, people in the communities where we need a hospital, where we need a provider, so that we could provide preventative health care. So that really through the power of that single payer, we could provide and target the dollars where we need them, so we could provide the most services to the most people.
And as healthcare has grown in Idaho, has there been a difference in the services that are provided for rural people? For example, I think probably more specialists concentrate in areas that are a little bit larger naturally. And if I understand correctly, medicine has become more specialized. There are fewer general practitioners, and you can correct me if I'm wrong about that. But is that a part of the problem as well? And do you see that as being an answer? Sort of a pool would then maybe change the resources in certain areas.
You're absolutely right about that situation. I mean, our neighbor to the north, Canada, has put some focus on making sure that they have more general practitioners, more family doctors and mid-level practitioners. And in the United States and in Idaho, we have a real concentration of specialists. And fewer people who provide the primary care. Well, the primary care is 80% of what we need, or better. Mm-hmm. And yet, we don't have enough people providing those kinds of services. So there should be incentives built into the system which would make it a better job to be a general practitioner and not push physicians into having to become specialists if they, in order to increase their incomes.
Now, another thing that we hear a lot about is the malpractice situation. Do you have a way that you would deal with the malpractice through your general structure, or would that still be a separate thing like it is today?
Well, you know, one, the whole malpractice issue is somewhat blown out of proportion as I understand it. There was a recent article in the Consumer Reports in July of the last summer's it suggested that it was about 1% of the total costs of healthcare were malpractice premiums, and that you might be able to get up in the range of close to 10% if you look at the area of defensive medicine, the practices that doctors use because they're concerned about a lawsuit. Under this scenario, you would there would be more predictability under that. There would be, I think, more attention paid to quality of care, and in that case, I think we would have hopefully set up an arrangement in which people would feel less litigious about it. But I think this is one that's going to have to be, again, one that's going to have to be tuned as the program develops.
This question has in no way is negative toward the effort that you're trying to put on, because really you're addressing one of the most serious problems in this state, in this country, and you're being commended by, I know, Janelle and I, for your efforts. But a lot of legislators who are really sympathetic to your cause had some difficulty last year with how you would deal with the problem that if you had this kind of very progressive program that would be a model really for some other states, that individuals who are in neighboring states where that kind of care is not available might move to Idaho to take advantage of this program, and could also affect the funding and so forth. How have you addressed that issue?
Well, there is a residency requirement under this bill, but it is similar to our voting requirement, so it is a relatively short period, because we can't disenfranchise the citizens of the state, even if they've only been here for 30 days. But at the same time, we think it's a real concern. In Oregon and Washington are looking at similar kinds of programs. Montana is also looking at similar kinds of programs. And so what we think that's going to mean is that actually there's going to be several states that will adopt similar kinds of programs at the same time. And of course, the other part is that we know that when one state does it, it's going to drive the whole effort to build a national healthcare system based on these same kind of principles. What we really believe, though, is that we in Idaho should have a role in shaping what a program looks like for a rural state.
On that note, I'm going to bring the program to conclusion. I wish we had more time, Roger. You have been most informative. And on behalf of Janelle Burke and our staff, we thank you for being with us today and talking about the issue of health care.
Thank you.
Ladies and gentlemen, I know you have found this program most informative, and as we indicated at the beginning, it is a very, very important issue to all Americans, and I would like to invite you to be with us again next week. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Telemedia Services on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.